Hello viewers. Today we will discuss relationship between vertebral level and a spinal segment. Vertebral column is the house of a spinal cord. A spinal cord is made up of 31 spinal segments. A spinal cord occupies L3 in newborn and only up to L1 in adult. Vertebral column is long and a spinal cord is short, just like sword within a case. Here you can see this is spinal cord only up to the L1 level, and anteriorly and posteriorly, as this is the sagittal section, these are vertebral column and this is spinal cord. So just like sword within a case. Spinal nerve coming out obliquely downward like a broom. Here we can see this is a spinal cord and it is made up of 31 spinal segment, and from each segment one pair of spinal nerve is coming out obliquely downward just like broom. Same as that of people staying above a step down to go out of exit gate. To know man coming out actually resides in which floor, or a spinal nerve coming out via the intervertebral foramen belongs to which spinal segment, there is one formula which link between the vertebral level and the spinal segment level. That is cervical vertebra. For knowing this, the spinal segment within the cervical vertebra, upper cervical will be the same, and the lower cervical you have to add +1. That in the cervical vertebra you have to add suppose C1. So that is the upper cervical, so +0. That C1 houses C1 spinal segment. But if it is C6, you have to add +1. So C6 vertebra houses C7 spinal segment. Like that, upper thoracic +2. Upper thoracic means T1 to T6. So T1, at T1 vertebra you have to add +2. That T1 vertebra houses T3 spinal segment. And like this, these are the formula. And to memorize this, I am giving you a very beautiful mnemonic, that is cervical you have to add +1. Sir is a Hindi word. Sir, that means head. Everyone has got one head, so you have to add +1 for knowing the spinal segment within the vertebral column or vertebra level. Upper thoracic, that is T1 to T6, you have to add +2. Upper thoracic, UT means ut. In Hindi there is word ut, that means to get up. We used to twill ear, कान मरोड़ते हैं, twill ear, for getting out of bed, and two is very much similar to ear, which is a link between for upper thoracic, that houses like T5 houses, you have to add +2, so T7 spinal segment. So upper thoracic, ut means to get up, and we used to twill ear, and ear is very similar to number 2. At T7 to T9 vertebra level, you have to add +3. That T7 houses T10 spinal segment. T7 vertebra houses T7 +3, that is T10 spinal segment. And to interlink in between these two, That's T7 to 9 plus 3. I watch at least 3 serial from 7 to 9 p.m. It is also 7 to 9 and this is also 7 to 9 p.m. And I used to watch 3 serial, that is Gum Hai Kisi Ke Pyar Mein, Imli and Saath Nibhana Saathiya 2. At T10 vertebra level, it houses L1 and L2 spinal segment, both. And to memorize this, T10 means 10. In Hindi, 10 means 10. So 10 Kadam is a movie. And for that movie, we used to run. So let's go 1, 2. It's a Samantha's movie, a South Indian actress. After Sushant Singh Rajput, them is, I don't watch Bollywood movie, so it's a South Indian movie. T11, it houses L3 and L4 spinal segment. T11 means Team 11, that is cricket team. And L is for Lala Amarnath. Lala Amarnath comes in 3 or 4 number, 3rd or 4th number. So L3, L4. T11 houses L3 and L4. Is the great Lala Amarnath. T12, it houses L5 spinal segment. T12, that is 12th exam. At 12th exam, it's true. You can search by Google. The 5 cricketers latak gaye the. That has failed. Okay, they didn't clear 12th exam. So T12 L5 latak gaye 5 cricketer in 12th exam. Sachin Tendulkar studied till 10th. Hardik Pandya failed in 9th. But they earned name in other field and made us proud. L1, that is, it houses sacral and coccygeal spinal segment. L1 vertebra level. We all know that at L1 vertebra level, the spinal cord end and it houses a sacral and coccygeal spinal segment. So L1 SC. L1 is first love. L1, first love. And SC, in Hindi it is sak. Sak means doubt. We should not doubt on first love. Please believe me that your first love is your book. It will always accompany you, this book, for your whole life, and it will make you proud, make you feel proud. Now coming to clinical significance, we are very much aware of vertebra level. Vertebra level, due to the presence of superficial bony landmark on back, that the vertebra prominence, this is at C7, and the spinous process of the scapula, it is at the T3 level, and inferior angle of scapula is at the T7 level, and iliac crest, above it is at the level of L3, L4. So that's how we can count the vertebra level. And when we got hurt at particular vertebral level, we come to know which spinal segment is going to be affected. Suppose is vertebra level is at the T7 level or T6 level. So first we palpate the inferior angle of scapula, and it is at the level of T7. Just before that is T6, and that is how we can, with the help of that formula, we can chalk out which spinal segment is going to be affected. And second is, when a patient complain of any, if a patient comes, complain of any pain, tingling, numbness in the periphery and has history of a spinal cord injury, then we can chalk check out which vertebral level is injured. Suppose one person comes with a problem in front of thigh, and front of thigh is supplied by the femoral nerve. Yeah, front of thigh, they are supplied by femoral nerve L2, 3, L4, posterior division. So L3, L2, L3, L4. And with that formula, L2, 3, 4. Here is the L2, 3, 4, a spinal segment. A spinal nerve is coming out from a spinal segment, and they are complaining on the front of thigh and supplied by femoral nerve. So the vertebral level injury is T10 and T11. So this is how we can check out which vertebral level injury is there. Thank you.